Hello, everybody, and welcome to the Evolving Practice Podcast. I'm Dr. Bill Moss with my co-host,
Hi, I'm Dr. Sean Carey.
and we're excited to bring to you an episode that we'll call it healing story time, if you will. We're going to be discussing some of the amazing, some of our favorite cases that we've seen and their healing journeys from chiropractic to the energy healing world. We just want to talk about how, as a healer, oftentimes we get a little desensitized to the miracles that occur right before our eyes, how amazing people do, and we want to just share some of like the greatest wins, if you will, over the years of being in practice as a healer and chiropractor.
Yeah, it's just like you were saying, it's so easy to get into the day-to-day, not routine, but just the day-to-day kind of rhythm.
Mhm.
And you sometimes forget like how the impact that can be had through these healing methods with people. And
Yeah.
one thing that I like to do if I'm ever feeling down is I'll like go through like Google reviews and testimonials that we've got over the years. And it's really amazing because you end up forgetting.
Mhm. Yeah. Yeah, we kind of get it's like becomes a normal everyday thing. Like, and to many people, they come in through our doors and they sit down with us, and it's a big deal. It's a big deal to them, with whatever's going on. And not that it's not a big deal. It's just I feel like I've had the same conversation, sometimes even on a weekly basis, with
Yeah.
the significance, the nature, the routine that somebody's gone through, um, and the difference that we can make. So, I mean, that's kind of what you want, right? In a healing relationship, you want somebody who your abnormal is their everyday kind of
Yeah.
life, and that sometimes I even forget. I was talking to somebody today. They were asking me about how long I was in practice or something in that nature. And I'm like, man, I've been in practice 13 years. Yesterday was 10 years since I opened my office
Wow.
in Pennsylvania. So,
Happy
over that
anniversary.
time, yeah, yeah. Over that time, there's been so many amazing things that happen. And we've mentioned them on this podcast. And even our own stories help kind of normalize the miracle. But when we were prepping for this episode, we didn't share personally any stories. But I'm curious what comes to mind. Some of your favorite ones with clients that you've worked with over the years.
Well, I'll start with just a couple that have happened recently that were fun cases.
That's what I wanted to do. Cool.
Yeah. And then we kind of like stroll down memory lane a bit, but just the past, couple months, I've had two cases that stand out to my mind, just because they're unique.
Mm,
One was a gentleman with trigeminal neuralgia,
mm,
so an older gentleman with trigeminal neuralgia. And for those who aren't familiar, trigeminal neuralgia is also known as a suicide disease,
mhm.
because when people have that pain, it tends to be so high and so extreme that they often, not a percentage of them will commit suicide to just
Yep.
stop the pain. And this gentleman had come in and he had two teeth pulled to try to help with the pain.
Yeah.
Had done multiple things and was just in excruciating pain, like 12 out of 10 pain, to the point where he could barely sleep through the night, like up multiple times per night, and in extreme pain, and just like couldn't sleep because of it. So he wasn't getting any sleep. This is going
Mm,
on for a long period of time. So we started doing upper cervical work with him. I did an upper cervical protocols with specific X-rays and different things, starting
mhm.
addressing him primarily that way. And within a month, he's a totally different person. It's rare for him to even wake up at night. If he does have discomfort, it's maybe a 2 out of 10 and not a 12 out of 10.
Yeah.
And this man is just so happy because he
Awesome.
like he was in hell in terms of pain.
Yeah.
And like when you're talking about extreme pain like that, it becomes the overriding force for your life. Like people
That's
just want
That's a
to.
great yeah, that's a great one to start with. I do practice upper cervical, and I've had a bunch of those cases over the years. And one of which I received a woman who she went down to North Carolina and worked with Dr. Ray Drury for about 2 weeks, 10 days. She like lived there, and he referred her back up to me, and she had to drive still 2.5 hours to come see me. And she ended up bringing all these people from her area. They practically like caravan, like 6 or 7 of them, to come down to get checked in my office, and she had debilitating trigeminal neuralgia, and she got her life back. I mean, she was ready to, like, she went to North Carolina to get help, right?
Yeah.
And same thing, I haven't seen her in years, but she was a wellness client of mine for a long time, and I'd see her every couple months, and she did really well. But she had that to an extreme case, and it. You might have seen this, like, if they ever have relapses, it's like really scary because it is a really
Yeah.
debilitating condition. But the other thing about just that, since we're on it, trigeminal neuralgia, people don't know what to do with that. They go to see dentists, they go to orthodontists, they pull teeth, they give injections. There's even some procedure that wraps the nerve in some form of um, like metal to try to protect it. Like, there's a lot of gnarly procedures, and upper cervical chiropractic care works wonders. And there's even a book, that What Time Tuesday. Have you ever read that book?
No, no.
It's called What Time Tuesday, and it's a person who's a chiropractic advocate who wrote a book, and he started going around speaking about upper cervical chiropractic because he literally planned his suicide. And he went to bed on a Monday night, I believe, and he laid down and he heard one of those like radio ads where it was a chiropractor was speaking about upper cervical on some like late night radio show. And I think actually the story is his wife heard it, and she made him an appointment, and he was like, okay, this is my last shot, but I'm gonna basically kill him. He was gonna take his life on a certain
Yeah.
time on that Tuesday. And he went to this appointment and he received an upper cervical adjustment, and he got home and he's like, I don't think that person did anything. It was a low force, like NUCA, low
Yeah.
forced upper cervical adjustment. But then all of a sudden he had a moment for like 15 seconds where it went away. And then he had another moment where it was gone. And he was like, all right, I'm going to give it another day. And he ended up giving it enough time that he basically promised, like, if he got his life back, he would be an advocate for this. And he wrote this book called What Time
Wow.
Tuesday. So yeah, it's a pretty big, yeah, it's a great story. It's a good book. It's really touching. I mean, because the guy was ready to just end it all and found hope. So it's a great method um, to help with that condition because people just don't know what
Yeah.
to do.
That's really cool. I didn't know about that book.
Yeah, there were certain offices that used to just buy it and like hand it out to
Yeah.
all their new clients and stuff. Yeah.
Yeah.
Mhm.
Oh, I love it. I remember the first time I had an upper cervical adjustment. I had it with Dr. Bill Trevins in
Okay.
Watertown, where I like got it was the whole workup, and I had been a chiropractor for a while.
Yeah.
I don't know if I shared this story with you. I was working as a chiropractor. I had a bad concussion from a car accident,
Mm,
and after that, nothing was like getting me better. I was having all sorts of issues that just weren't resolving. And then I
interesting.
ended up, yeah, going and trying upper cervical chiropractic, which I had heard about, but it wasn't. I had never gone through like the full workup of it.
Okay.
And I remember I got adjusted by Dr. Trevins, and it was a weekday. I ended up going home, and I just fell asleep for like 4 hours in the middle of the day. And then I was walking down the street. I just had the urge to go for a walk, and my shoulder popped back into place.
Wow.
Yeah, which was like it was one of my initial injuries that got me into chiropractic when I was 17. And at that
Interesting.
point, yeah, I was working as a chiropractor. I'd been adjusted hundreds of times by many different great practitioners. But it
Mm.
was like that was such a powerful first adjustment for me.
I,
And
that's
yeah,
I kind of want to share. I kind of want to share how I got into it too.
yeah, please.
It's funny. This wasn't meant to be about upper cervical, but it's kind of it kind of lends itself.
Yeah.
When I was school, I don't know, were you introduced to it like during school at all? Like
I
upper
was
cervical?
I was introduced to some of the concepts and theory about it, but to be
Mhm.
honest, I think it was almost something that was a bit maybe looked down upon. Like it
Yeah.
was, it just because the upper cervical. To just give a little bit more explanation to that, it's kind of going back more in chiropractic history. Like
Yep.
it was a very advanced technique. It is a very advanced technique, but it's something that our forefathers did, and they worked their butts off to perfect this technique.
Yeah.
And sometimes people now kind of like almost look down upon it because they don't realize how powerful it is. And they're also doing it without a level of mastery or deeper understanding about the
Yeah.
thing that they're judging.
Well,
So
it's funny. The first time I ever heard about it was I was going to this. I used to be a competitive distance runner, and I was training for all kinds of marathons before I got to chiropractic school and during chiropractic school. And I went to like an active release therapist, ART, and she was a massage therapist. Sometimes chiropractors like to do that technique. Anyway, she was really helpful because she was a professional triathlete. She had a background, and I remember I was telling her I went to a really like quote specific chiropractor, and she was like, "Is it one of those that only does like the neck or something?" And I was like, "No, I never heard of that. Sounds weird." And I remember it was a Gonstead chiropractor that I was going
Yeah.
to for that was the style or technique. But when I was shadowing my wife's chiropractor at the time, and he was like an Arnaud Brenier follower. He was a really good full spine adjuster, and I mentioned this comment, how she asked if I went to, and he goes, "Hey man, don't knock it. Those people are awesome. Those
Yeah.
upper cervical people, they know what's up." So when I got to school, I was always fascinated, and the first adjustment I received was from Andy Farelli. Did you know Andy
Yeah. Yeah.
Farelli?
Yeah.
Okay.
Yeah.
I did a seminar, a technique seminar of his in like my third quarter, and he was like a hammer. I mean, that guy adjusted the crap out of people. And I remember he put my head in, he adjusted my C2. I was in the knee chest posture position, and he was teaching on me. He goes, "Look how far the C2 is rotated." And I was like, "Oh," and then he just like hit me and it went, and I was like, "Am I alive?" But
Yeah.
that night I stayed at Brian Lieberman's house. Like a bunch of us stayed there because it was 2 nights, the seminar. And I slept on my back the whole night and didn't wake up. And I remember just being like, that was the best adjustment I've ever received.
Yeah.
But I ended up really doing it because when I was in my peak program, which is like an internship, I w- I still, me and my uh, co-peak student Kevin Britt, we were like starting to practice this technique a little bit. And I remember the doctor who I was working under, he had a case. It was like his pastor's wife, and she just had these headaches that would not go away. And he's like, "Bill, why don't you do your thing?" He was like, "Why don't
Mm.
you do this technique with her?" So I analyzed her, I adjusted her, and but I didn't have X-ray, like I didn't have X-rays, I didn't have scanning
Yeah.
technique. Basically, I did the a type of adjustment without the objective measures. And we didn't really rest her because that's part of the protocol and upper cervical. You rest afterwards, but she rested like on a flat bench for like 2 minutes and was out. Well, she called the office about an hour later and was like, "I just feel kind of out of it and woozy." And he gives me the phone, and I was like, "Oh, well, typically you would rest, just lay down, give it some time." So I'm like, we had our orientation that night, an educational thing we were
Yeah.
doing. "I'll call you after and see how you're doing." So I call her after, and she's like, "I'm doing so well right now. I've had this is the first time I like haven't had a headache in 6 months." And I was like, "Oh my God, this is awesome." So she comes in a week later. I recheck her with the protocols that I have, no scanning, and it's close. I feel like maybe I should wait, but she's like, "I'm going away next week. I really don't want to, blah, 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 blah." I get sympathetic. I adjust her. She has a horrible reaction. It does not go well. The doctor doesn't take responsibility. He throws me under the bus. And I was like, if I'm going to do this right, I'm gonna get the right materials. And that next day, it was a Thursday. The next day, Friday, I drove to Alabama. I purchased a Titron, a thermography, and I was like, this was 3 weeks before I graduated. And I'm like, if I'm gonna do this
Wow.
technique, I'm gonna do it right. And
Yeah.
then basically the next year, I dedicated myself to doing this technique. And so I went to every single seminar I could find in the next year to like really get good at what I was doing because I really wanted to do it. I was like,
Yeah.
"Oh, I
Yeah.
saw the power. I
Yeah.
felt the power. I saw the power. Now I want to do it." So,
It's an incredible technique. I have another gentleman that I'm working with right now. A very interesting case. It was referred to me by another chiropractor. The case basically stalled, and it was this gentleman who had uh, s- some hip trauma,
mm,
failed hip surgeries, and significant hip trauma over a long period of time, to the point where it's just completely immobilizing, like
mm,
completely immobilizing, almost paralyzing, and
wow.
almost to like the entire side of the body, if you will. So we started working together, and the focus of it was upper cervical chiropractic. There
Mm,
was some other pieces that I was doing as well, but the response has been absolutely incredible. So the case went from, severe to doing great.
That's awesome.
Yeah.
Yeah, a recent one today, I actually had a first adjustment with a woman, and she had been to a chiropractor. It had been 7 years. She went to somebody in like Long Island and moved to the area a couple years ago, and she just was like, my whole spine's a mess. I'm a mess. She's like 77 years old, but she got really good results. And the one unique thing she described was like she's like, my eyes have been getting bad and like they're
Mhm.
blurry and they're kind of watery all the time. And she goes, you know what? When I was under chiropractic care, um that wasn't I noticed that got better, and I was like, oh, okay, that's cool. So after her first adjustment today, she rested for 15 minutes. She comes back and she is just raving. She's like, my eyes just went watered completely, and then they're
Wow.
totally clear. She's like, I can see you better than I could when I was walking in. I'm so happy. I'm so my And she was just running around my office today telling my staff like how grateful she was about this experience. And it's like part of me going into that is like, I wonder if this will work with me working with her. You know what I mean?
Yeah.
And
Yeah.
just to see that quick of a turnaround is very hopeful that the progress will continue. So it's always exciting when that happens at the beginning.
Oh, it is. It's such a fun sign to see. Another case that comes to mind right now is that I have this young boy with autism that I've been working with,
Mm,
significant autism. We started working together, and his speech has improved dramatically. So many
mm,
different his OT, he's doing so much better in OT. Like he's working with multiple practitioners, and the parents and every practitioner are noticing just profound improvement in his case. Like he
awesome.
had been essentially stalled for a long period of time, like wasn't having significant breakthroughs. And
Mm,
then we started doing chiropractic care, especially with a focus on the upper cervical spine, and really helped his nervous system to come into a better state of harmony and relaxation. And
mm.
now he's just taking off with all these different spectrums of his care, and his speech is noticeably different.
Yeah. Yeah, it's amazing how quickly like kids will catch up when they get proper nervous system function. Even if they've been like delayed for a couple of years, it's like it snaps back in and they
Yeah,
catch up pretty quickly. I've
yeah.
seen that too. That's really good.
That is one of the beautiful things about chiropractic too, is that the body wants to be healthy. The nervous system
Mm,
wants to be healthy, and sometimes it's just that there's an imbalance that's interfering with the healthy function of it. And
yeah.
it's not that it necessarily needs a massive intervention. It's just you have to bring the system back into balance so that it can do what it's trying to do all along.
Mm, mhm. Yeah, it's so funny when there's like a million stories, but today I had like a couple even profound things. Like my daughter was a little under the weather today. She didn't go to school, and on Mondays after school, my wife brings her to the office, and then I spend the rest of the day with her. And because she was at the office, I decided to check her today, and I checked her, I adjusted her, and she was really stuffy this morning. And like we're driving home, and like over the next 2 hours, her stuffiness like resided and her energy level came through and her fever broke and kind of came back to normal. So it was like pretty cool to see how she went from like low level ho hum energy to like
Yeah.
perking up, not having that drainage. And you could just see how like the body kind of just got an extra gear that kind of helped jumpstart the rest of what she needed through the healing, which was really cool to see too.
I love that. And
Yeah.
that is a big part of it too. I remember years ago, I had one of the things that really helped me when I was young in practice. I became a part of the board member for a group of Massachusetts chiropractors, and it had
Okay.
been one of the oldest running chiropractic philosophy groups, I think in the entire country, maybe even in the
Oh,
world.
yeah. The MACP?
The
Is that what it is?
MACP.
Okay.
And I was on the board, and part of what I did was help set up the events. We literally fly in people internationally, so we'd have chiropractic college presidents come, and people coming from around the world, from New Zealand and Spain, and the best of the best would come.
Does
And
that
I
does
would
that still happen? Does it
It still
still go
happens,
on?
yeah. And
Okay.
actually, me and Tim and Nick are speaking there in December.
Get out, really?
Yeah, December 14th, we're going to be there. So
Oh, cool.
yeah, we were just emailing earlier today about like our presentation, about what we kind of, who's doing what in the breakdown and what we want to do. But I had we'd bring in the best of the best. And I remember one of the people we brought in was Dr. Adrian Wedban from Barcelona College of Chiropractic. He was the president
Yeah.
of that. And a brilliant guy. One of those people that you listen to him talk and you're like, oh, this guy is incredibly smart, incredibly knowledgeable, and has like uh, he just an amazing intellect and really deep understanding. So I'm out to dinner with him and another mentor of mine, Dr. Peter Kevorkian, who had been teaching chiropractic internationally for decades.
Hmm.
We're out at dinner, and they were kind of like asking me, they're like, what do you want to, what are you enjoying in practice? Like, how's practice going? What do you learn about? What are you experiencing? And I was like, I'm getting kind of bored with the everyday stuff. I think I want to do more of the really difficult cases. And it was like coming from a place of a bit of arrogance. And it was,
Mm.
I was young then. It was, this is 10 years ago.
I've been in practice. I've been in practice 2 weeks. I haven't seen
Yeah,
enough
yeah, yeah.
crazy.
Of course, like the arrogance only a new practitioner can have, right? But like, so I was like, I really want to work with the complex cases and
Yeah.
focus on that. And they both like basically stopped eating, and they like were like looking at me and started grilling me, and grilling me. And I think it was Peter who was like, every adjustment is a miracle. And I
Yeah.
was like, yeah, yeah, yeah. And you trying to move on the conversation. And literally, Bill, for like minutes, like they just kept bringing me back. Like every adjustment is a miracle.
Mm.
Every adjustment is a miracle. And the point that they were trying to get across to me was that it's the person that you adjust, and then they don't blow their back out when they're doing
Yeah.
yard work.
Yeah.
And because of that, they don't end up on opiates. And because, and it's like, there's this effect of what happens when we're taking care of people with even just the basic stuff. Like I have a headache, I
Mhm.
have, low back pain, sciatic pain, or whatever is going on, that every adjustment is a miracle. By getting the body to function at a higher state, we help people to avoid so much suffering. And
Mhm.
one of the things that you and I both know too is that when the body functions properly, you're much less likely to get injured. You're much less likely to have those severe things.
Yeah.
So, although it may not be quite as like glorious
Mm.
as some of these, these other cases, it's like the impact that we're having is so big, and it can be easy to forget about that.
Yeah.
And for years, I had that, like I put it in a frame. I wrote every adjustment is a miracle, and I had it in a frame on my desk in a couple different spots in the office. So if I was
That's
ever just feeling like, oh, this is just, if I was ever having the feeling that this is just kind of like routine for me, it was like
Mhm.
there to remind me to, this
Yeah.
this isn't the routine thing. This is something that you're going to have a huge impact on a person by preventing something.
That's a really good one. And I'm sure you found this at times where I'm better with my own chiropractic care, and then I'm not as good with my own chiropractic care. And I would say since my daughter was born, um, I just probably got checked a little less regularly because
Yeah,
of that. And I haven't had an associate for 2 years, so it was usually a little bit easier to get checked with an associate. And I was like, the past couple winters, I had rough winters and I used to never get anything. I used to like
yeah,
stay pretty well and healthy. And this year I was like, I have to be on a consistent basis. And I've been consistent the last like 6 months, like very consistent, like probably every other week getting checked.
amazing.
And things have been so much better, so much better. I just feel like I get better sleep. I'm more resilient. I don't get everything my daughter's gotten this year.
Yeah,
And you're right. It is kind of that understanding. I said that to somebody today. They like came in and they hadn't been here for a little while and they're like, I was doing pretty well. And then I threw this out and I go, well, and they were, of course, because I was away last week, right? So you
yeah.
always have how many emergency people did you have that haven't
Okay,
come
yeah,
in? You haven't
yeah,
come in for multiple months, but last week they needed you, and it's like
yeah.
you just left the area and they needed you.
Yeah.
And they wanted to tell me about it. They wanted to tell me about it, and I welcomed it. But the reality was, I was like, "Well, you should have just come in before, and maybe we could have just like prevented this from going." They're
Yeah.
like, "That's a thing," and I was like, "Yeah, of course that's a thing." I'm like, oh man. So
That really it is the most important thing I think with people with that is, and it's the hardest. I feel like of all the different concepts to communicate with people, that is probably one of the hardest things for people to actually get, is that
mhm,
like Like sometimes we work with these people, and it's like their body has gone to such a severe point of it's having such a severe negative reaction,
Mhm.
but it's almost very rarely that actually happens overnight. It's usually there's been a buildup going on for a while.
Never. Yeah.
And you know, if we can catch it, like as the upswing's just starting, you can often just prevent the entire cycle that's about to happen. But
Mhm.
it's like people are like, "Oh, I feel like this will just get better on its own." Like, and then
Yeah.
it's just getting worse and worse and worse. It's like, "Oh, you know, maybe I'll just take some more ibuprofen," and it's getting worse and worse and worse. And then a week later, it's just like, it's or a week later, a month later, a year later, it's severe, severe.
Yeah. Yeah, it's like a divorce. That doesn't, like, happen overnight, you know?
Yeah,
That's like a long, disconnect and never reconnection, and that's the same
yeah,
thing, what happens, like, the spine is disconnected, there's nothing like it's even a crazy thought, we're going in so many directions on this, I
yeah,
love it. It's like a crazy thought when, like, somebody goes to pick up a piece of paper and their back went out. It's like, how
yeah,
dysfunctional were you for that to occur? Like,
yeah,
that dysfunction has built up over time to the
yeah,
point that you did this thing and it tore. And, it's when your internal forces can't handle the external world that we
yeah,
have this breakdown. So, what we do, the miracle is preventing those things. And it really it is a tool to keep people going and repairing and adapting. Adaptation is the best word for chiropractic because anyone that thinks you're not gonna feel pain or experience discomfort and injury and accident and up and down, like, you're just not living life then. You're not challenging yourself because 'cause you're gonna have those things. But chiropractic helps your nervous system just continue to adapt to everything that's going on. And, actually another one of the cases, I've had a client for almost 10 years now just speaking on adaptation, and he came to see me for some back thing, and he did great after a couple months, but then spring came around and he had no allergies, and he hasn't had allergies since. Not no allergies in the last 10 years.
amazing.
And he went to his doctor and he was like, "Yeah, I don't need my allergy meds anymore." He's like, I started going to a chiropractor and the guy, like, it just helped. And the guy's like, "That's just a bunch of bullshit," like that kind
Yeah,
of thing. And it's
yeah,
always funny to me, like, we've talked about this before. It's always strange when something like that happens and somebody's like mad about the fact that they don't have
oh yeah,
allergies. And I
yeah,
don't think I think it's just the insecurity of like being okay with like people get well and they can from other methods and means that aren't necessarily the old traditional way. But he's been so grateful for years, for 10 years. He hasn't had any allergy medications anymore.
I absolutely love it. Uh, another funny case that comes to mind is that when I was in chiropractic school, my roommate had this old wiener dog. He was also in chiropractic school. So he had this old wiener dog that had been run over by a car. His name was Bob.
Was
You
this
know,
Jason?
Dustin. I don't know
Oh,
if
okay.
you've heard of
Oh,
him before.
okay.
Dr. Dustin Reef. So he had this wiener dog that had been run over by a car. The dog's name is Bob, and Bob was like, you know, one of those dogs are low, but he was obviously in pain. Like he was an arthritis, like he was an old dog, didn't move
Yeah.
slow, had severe trauma getting run over. One of our teachers was a veterinarian. This guy's an amazing veterinarian, and he also did animal chiropractic. So Dustin started bringing Bob to get adjusted. And like with animals, you typically don't have to do it that often.
Yeah.
It was like this dog who could barely move started jumping up on the couch. And for like a wiener dog, like that's like four
Yeah.
times higher than it
Yeah.
was. And it was like this dog went from being like acting like 12 or 14 years old to acting like 4 years old.
Mm.
And it was just one of the good such a cool case because the dog's not thinking about anything about it. It's not like, "I wonder if this will work or not work." They don't have thoughts about it. It just
Yeah.
is. It's like, "Oh, I couldn't move and now I can move." It's just, you know, animals are very good at that.
This is
And
that's so good.
but it was just such a cool I don't think I'll ever forget it. It was just such an amazing response to the power of chiropractic. And it was like the dog didn't care about the science or, you know, or any of this. It's just like
I
it felt better. Its body worked better. It could jump up again.
let me tell you this dog story I have. So my one of my close friends in chiropractic school was Austin Comerick. Do you know
Yeah,
who Austin?
yeah,
So
yep,
his dad's Jay Comerick, and Jay's like, one of the, an animal chiropractor. He flies around barns, takes care of horses, like,
yeah,
he knows how to take care of them. So Austin really knew how to adjust animals. And my friend Carl and Austin were roommates, and Carl had a dog, and Austin taught me enough to be like dangerous, enough to like know how to take care of a dog, but I would by no means not consider myself an animal chiropractor. So I'm practicing in the office in Georgia, and the other two doctors who were brothers, they knew I knew something about animal chiropractic. So there's this one client, Rich, and Rich had a chocolate lab that was 2 years old named Hercules. And Rich was like telling me about his dog and how his dog's back legs don't work and he's like can't walk really well. And I was like, oh, how long's that been going on? He's like, oh, since birth. And one of the other doctors goes, have Bill adjust him. He knows how to adjust dogs. And I was like, okay, fine. So they bring him in. I check him in the parking lot. I adjust this dog, and his back legs were like bent this way. He like couldn't use his back legs. His paws like wouldn't grip the ground. It was really an unusual gait. So I adjust him. The next time he comes a week later, he's like flip-flopping his legs. They're kind of like rotating to the feet and then the back. By the third time, he's just running across the parking lot. He
Oh
sees
my
me
god.
and he's just like
Yeah.
excited to see me. I mean, this dog went from like, and I barely knew what I was doing, but enough to
Yeah.
like see how this works with an animal. And anybody that's seen an animal, a horse, get adjusted, it's like, you can see the power of what's actually going on. So
Yeah. Yeah, it's absolutely unbelievable. And it's just it's so cool because they don't have, their heads aren't getting in the way either,
no. No, that's how kids are too, right? It's
Yeah,
like I just had a baby who was severe torticollis, and they were like, "Let's send it to PT. Let's do this." Like one adjustment, the head's like straight. It's
yeah,
normal. We're doing a little cranial work because the head was stuck one way, so it was getting flat on the one side. And
yeah,
already in like a couple weeks, it's getting better. And the baby's not like mental about this process at
yeah,
all.
yeah,
It's 4 months old, 3 months
yeah.
old.
One of the things that's funny to me is when people are like, "Oh, is this safe for kids?" It is like people don't really have an understanding about how gentle chiropractic actually is for children.
Yeah.
But it reminds me of something my friend Dr. Dave Steinberg says when people are like, I don't want you to twist my spine, is what people would tell him sometimes. He's like, I'm trying to untwist it. Like it's already twisted. Like we're trying to fix it. We're trying to untwist it.
I love the way people describe stuff. It is so funny to me. Like
It
how,
is.
we should do an episode just on that. The funny stuff people just say to us.
Oh yeah, it's but then you have with some colleagues who just have really good responses that can just reframe for people.
Yeah. Yeah. Do you know what my favorite thing to say to clients is? You can try this one too. When they're like, I'm not in pain anymore, doc. I was like, where do you think it went?
I love that.
I love asking. They're like, I'm getting so much better. This thing is gone. I was like, where do you think it went?
Yeah, yeah, I love that.
It's a good concept, right? It's like, where
Yeah,
does it go, right?
yeah, yeah. Well,
Yeah.
yeah, and I mean, people can have uh, like pain becomes a part of that identity, and then just have it
Oh
not be
yeah.
there.
Oh yeah, people run away from it, that's
Yeah,
probably the people that can stick through some of the ups and downs, that's fantastic.
yeah,
It's funny because we were gonna, like, talk about all healing stories, but I feel like we could go on with chiropractic ones, so maybe we'll just do another episode about, like, some of the other healing work and the different changes we see with those people because, it
yeah.
could go on. Um, let's end what's your, like, one of your all-time favorite ones, um, along the way?
Oh man, I think this is still probably my all-time favorite one. It was an assistant. It was a woman I hired. Her name's Britta.
Mm,
I hired her because I need an office assistant. She had never had chiropractic care. But I need somebody to, answer the phones and collect money and that type of thing. And she came into the office, and I didn't know anything about her medical history because it's not something that you really like. You're not asking somebody's medical history during a job interview, right? Like
yeah.
it's a totally different thing. And she started working for me, and then we started. I was like, "Hey, I want you to go through this new patient process, just so you have an understanding of what people go through." So
Mhm.
she came in and we did a new patient intake, and she was literally on like 17 medications.
Wow.
She was getting her blood work done every 3 months to make sure that her liver and kidneys weren't failing with all the medication she was on.
Mm,
She had
mhm,
migraine so bad she'd be temporarily paralyzed. She had asthma to they call it non-reactive airway disease when somebody's really
mhm.
young. I think before age 4, she used to get air flighted to the hospital by helicopter for non-reactive airway disease. Just a history of uh, intense health issue followed by intense medication, and then the medications built up over time.
Wow.
So I started adjusting her. Well, first we did the workup, and then she had never had chiropractic care before. We looked at the X-rays. There's significant scoliosis. There's a lot of different things going on, and I started adjusting her. Within 2 months, she went for her checkup with her medical doctor that she saw every 3 months to get her lab work done because they literally had to test the liver enzymes, make sure everything was still within normal range. And there was no long-term plan. They weren't planning on taking her off any of these 17 medications. It was just like slowly more were getting added, and then eventually they just knew it wouldn't work anymore.
Wow.
So she went in. She was doing so well. Her lungs sounded so good. The doctor was like, "I've never heard your lungs sound this good in the entire time I've known you since she was a child. Let's start
Mm,
taking her off these medications."
mm.
And they ended up taking her off all but like one or two medications.
Wow.
And then I wrote up like I sent the kind of doctor a little folder just going over her case and what I did and the extra results and the scans and things, and in case he had any other clients that maybe could benefit. And the only thing he said back to Britta was just make sure he doesn't take too many X-rays. And I was so annoyed because I mean maybe it's not like we took a ton of X-rays.
Yeah.
We it was very standard, but it was like she's been on 17 medications for years and years and years and years,
Mm.
and the only response is don't take too many X-rays. Like it was just a total lack of interest and something that really helped one of his clients that I was just like I'm still a bit annoyed by
Yeah. Yeah. I can.
it.
It's yeah. Oh my gosh. Oh
Yeah,
my
like
god.
if I had a client that was in, just having severe things going on to the point where you had to do something like that, like you'd
Yeah.
want to be open to the possibility of what can help another human being.
Yeah. Yeah. Yeah, that they make the best employees too. I had
Oh,
Caitlin who works for me now. I took care of her whole family. And also she's part of the center now, and she's had a really great testimonial for what's happened with some of the light work. But probably my favorite story. I think I might have told this story on a different podcast, but was a little girl, 17-year-old girl from when I was practicing in Georgia, and her grandmother was under care, and her grandmother was local, but the granddaughter lived in like Pensacola, Florida. I practiced north of Atlanta, Georgia, about an hour, so it was about a 5-hour drive. And the girl was 17. She had like 54 out of 61 days with seizure episodes, to the point that she was like losing vocabulary. She was like forgetting her parents' names. She was going to Emory University for all these sleep studies and neurologists and everything, and nobody could figure out what was wrong or do anything. So she got under care. She started living with grandma. Grandma had like come to our orientation and understood what we did and was seeing good results. And she brings the granddaughter in. The granddaughters just look like kind of black eyes, depressed. She hasn't like been able to hang out with anybody. We do the workup. I get her adjusted, and she basically spent 2 months getting intensive care, and she only had one seizure the whole entire time in those 2 months after she started
wow.
getting care. And at the end of it, the mom was like, we were releasing her. We're like, let's just check her every month or something. And she's like, I think it's worth it for like five and a half, 5.5 hours for for not having these seizures. And they were ready to like wanted to take part of her brain out and that kind of thing.
Oh,
Like it was really quite intense. So and this was early into my tenure. This was like a year and a half into practice. So and the only seizure she had a mild one in the office after an adjustment, and
hmm.
that was part of the body releasing it. It wasn't that scary. Like it was just more of like an absent type seizure, but
Yeah.
she knew she had it at that point, and she did really well and got recovery. So that was a big one that helped me understand like the power and the responsibility of what we do, and then treat everybody like it. Kind of like you said, if it has the power, if chiropractic adjustment has the power to do that with an individual who's experiencing that level of dysfunction, what kind of connection and function can it help restore in somebody before they even get to that point? You know?
Yeah, I love it. That's
Yeah.
that's really amazing. What an impact on that person's life too. It's like they get to live an entirely different life going forward.
Yeah. Yeah, and it's almost nice sometimes. I don't know where she is or what she's doing or what's going on, but
Yeah,
I imagine it's better than what it was then. Um,
yeah, yeah,
and we really that's how it was for me. I was suffering in our first episodes. We talked a lot about our stories, but I had debilitating panic attacks and went from doctor to doctor, and my life could have been lots of medications in and out of many different things, and I found this really helped turn things around for me, and it helped me go deeper with other modalities of healing and that we incorporate now. And it's by being in that place, I've learned so much to be able to take care of others, and I think we both feel the same in that way.
yeah, absolutely. This really is. It's a profession that the vast majority of people get into because they have a firsthand experience with it.
Yeah.
There's some little like an interesting historical tidbit was that when chiropractic at one point, like it was really all the natural healing methods were very low and they almost kind of went extinct at the early part of the 1900s.
Yeah.
And people started going when the world wars started. There were people who were exposed to chiropractic there. Some of the soldiers had been chiropractors that got called into war, and
Mm.
it helped them so much that there was a massive resurgence in chiropractic, where
Mhm.
soldiers who had been at war, they came home and they're like, "What do I do? Like, I want to be a chiropractor because it helps so
Mm.
much." And
That's
there was
awesome.
this massive influx as far as new chiropractors.
That's awesome. Yeah,
Yeah,
you tend to get a lot of passion from chiropractors, and that's good because they want to serve humanity. They want to serve people to a higher degree. And I think the thing that sets them apart from many other professions is especially the people who are devout to the roots and understanding of chiropractic, is they respect the immaterial of a human
yeah,
and the intelligence that actually runs the body. And I think in healthcare we need more respect for what a person is actually capable of and where
yeah,
healing comes from, because in our world and even the energy world, like, all healing is self-healing, and
yeah,
we serve as a reminder for that person about how amazing they truly are. So I think that's why that in itself, holding that in our hearts and our beings, is really important. The practitioners, how, who they are and what they believe and what they're carrying, definitely matters in the equation. And you see that in a lot of chiropractors. They're really passionate. They have really great hearts for service, and they're willing to show up every day and work hard and serve. And people have ups and downs, but we have to stay consistent. So it's a great profession.
absolutely. Well, I think that's a good point to end the
Yeah.
episode on.
Yeah, amazing. Yeah, this was a fun one. Who knew we'd have so many. We probably have a whole nother episode of stories, but this was
Totally.
a good one. We'll explore, maybe in the near future, some of the you know s- uh big changes and stories that we saw with energy clients. We do have a couple interviews coming up, which we're excited to share with people in our community. So thanks for joining us. Subscribe, like, share, rate, review, do all the things for us. It really helps us as we continue to grow. We're so grateful. We've been at this almost a half a year, and it continues to build and grow. So thank you for joining us. And we look forward to speaking with you soon and sharing more to come.
Thank you all so much. See you next week.